Okay, welcome. Well, we're here today with Jordan Smith, CEO and co-founder of Jet Dental. Excited to talk to Jordan, hear his story. If you don't know what Jet Dental is, I'm going to have Jordan give us a background, give us actually what Jet Dental does, and then we'll talk about the story, how it came to be.
Yeah, Jet Dental, we're a nationwide pop-up dental clinic for workplaces. So we go into like a spare conference room or training room, and employees can sign up and get their dental cleaning done for free, and we just bill the dental insurance, so it's free to the employer.
Hard to beat that offer. I think that's the unique thing, is that as an employer, getting your employees to get the care they want and then making it affordable, but then you have an offer that's free to the employer. It's pretty, I mean, to me, that's an amazing sales opportunity for your team to go in there. How did the idea come about? I mean, because dentistry's been around a long time. We've had dental insurance. There's a disconnect sometimes between what dental insurance does versus what the dentist does, but how did this idea get formed? And
it's not the sexiest story, unfortunately. I wish it was cooler, but my dad and I, we were looking to start a business together. So we actually had hired a broker, and we were looking for like smaller businesses that we could maybe buy and then scale up. And we flew across the country, looked at a bunch of stuff, and we really didn't find anything we liked. We did meet one dentist who had like one set of equipment, and his wife was a hygienist, and they were going to nursing homes, and they wanted $9 million for their business. And that was like, oh, it seems like a lot. How many clients do you have? And he didn't really have clients. It was like a side gig, right? Like they just, oh yeah, if we want some extra work, we'll call somebody and see if they'll let us come on the weekend. So we're like, okay, well, we're not interested in your business, but that concept of bringing dentistry to somebody, kind of that planted that seed there. So my dad and I started talking about that and saying like, I wonder if that could work. And so my wife had worked at a dental practice when she was in college, when we were in college, married together. And I was like the prototypical bad patient. Like she would make me an appointment, and I would cancel the appointment like same day because I was like, oh, I got this meeting, and I don't really want to like drive across town and go get it done.
Not high priority.
Yeah. So like I was a bad patient, and my wife worked there. And so I knew there was probably a need to some degree, and we talked to a dentist, and he said, yeah, this is how the model works, and I think it's a fun idea. Let's do it. So we tested it with a few businesses here in Utah, and really quickly got like great reviews. And I think the big aha moment for us was we found that everybody signing up hadn't been to the dentist in a really long time. So we're going to all these tech companies here in Utah, and you had all these younger folks who stopped going when mom and dad stopped making their appointment. And on average, a Jet Dental patient hasn't been to the dentist in over 2 years. And so to me, that's where we're like, oh, we got a business here. Like there's a need here. And from there, we've just been growing ever since.
What's been the hardest part? I mean, getting it off the ground, obviously proof the concept worked. What was the next phase? Like how did that come together?
Yeah, I mean, I think by far the hardest part is scaling and being profitable.
Because you don't come from dentistry. I think that's what's unique about the story, is that you're not a dentist, your dad's not a dentist.
Background. Yeah.
But you saw the need to get more people, really I think the initial care of cleanings and making sure that we're catching things early. I know firsthand. I mean, I thought I was doing a good job going to the dentist. I missed probably for a year, and then I went back and ended up getting a root canal, which was an awful experience. Yeah. Could have been avoided had I been going more frequently. And I think that's that's the problem you're really trying to solve.
For sure, yeah. So so much in dentistry, if you are going regularly, can be caught and prevented. Yeah. So there's stats out there, like Cigna did a study where they tracked the same group of members that had medical and dental with them for like 5 years, like 1 million people. And they found that people who went just once a year, so not even the 2 times recommended, right? Like just once a year and got their cleaning, their overall healthcare costs went down by like 33% in that period.
Wow.
Compared to the other group who didn't go once a year, and they had 40% higher increase in costs. They had higher hospital admission rates, they had higher ER rates, and I don't remember the exact numbers in my head, but they certainly had worse health outcomes. And so I think why clients ultimately choose to have us on site is probably one, like it's just an easy thing to offer, and they already offer on-site massages and things like that, and why not have a dental office come? But typically why they sell it to the C-suite, the HR people sell it to the C-suite, is because, hey, if we can help people prevent, go regularly and prevent worse health outcomes down the road, we're going to save money on our premiums and just keep them healthy and keep them here in the office.
So initially, was it adopted pretty widespread? Was it very easy to sell, or did you have to do a lot of that?
Yeah, I mean,
work up front?
I think the very first year was probably like working out the kinks a little bit. Like we used to have, like we have these really nice pop-up privacy walls now that look really good and are branded, and like that was one, like a small example, a microcosm of like one thing we had to figure out, right? Like we used to have like these big, huge projectors that you'd like an actual like PowerPoint projector type thing, you know,
Yeah.
that they wouldn't fit in like half the elevators. And so the first year was probably a little bit of like making sure we worked out the kinks with the service and making sure we felt really good about it was a good, clean look and feel and people felt comfortable and safe.
It's like the experience for the employees.
Yeah, just that, like the patient experience was really good. The employer experience was really good.
Yeah.
And I feel like once we nailed that down in that first year, after that we started selling them, it went gangbusters. Like we were selling really, really quickly. Obviously we had that, you know, it's free to the employer. We're just building dental insurance. So that makes it easier, right, to get your foot in the door and get a lot of calls with folks. COVID nearly killed us.
Yeah, I was going to ask about that. That had to be a tough when people
Yeah.
weren't in the office. How did you adapt? What was
that was by far our biggest challenge still to this day. You know, it's a really hard thing that we dealt with. So we hadn't raised money until I think we closed in January of 2020 on a small round of outside funding. And, you know, we were going to use it for growth. And I think, unfortunately, we just had to hang on to it and kind of survive COVID, if you will. So it set us back probably 2 full years before we were back to growing beyond where we had projected to hit in 2020.
Yeah.
The huge upside of it was we used to have like 6 or 7 national competitors, and now there's really only one other competitor, and they're really in a different space. They do like permanent dental facilities. Most clients we serve can't have a permanent facility, right? We're just going there 2-3 times a year. And so it really wiped out all the competitors, after COVID. And so we, on the other side of COVID, have been growing faster than we've ever been growing. I think because there's not a lot of people out there with this unique offering. There is a lot of return to work activity right now, and we're kind of capitalizing on some of that. But back to your initial question of the challenge, just growing and scaling and making sure you stay profitable, it is a challenge, right? Just knowing how to navigate that. Fortunately, we have some good investors and some good folks who've helped us strategically and on the capital side to do that, but that's just really challenging.
Yeah, so probably staffing and figuring out the different areas where the businesses are, which leads to a couple questions. I think the first one, for the local dentists, and this is something unique that I didn't really understand until we first talked, you're not necessarily a threat to them, I think the key component to it is maybe you would think initially, here's a dental office coming to the business.
Yeah.
These employees are not coming to you, but that's not the case. So talk about the relationship with local dentists and how that has worked out.
Yeah, I mean, I think, to be honest, probably local dentists feel threatened when they hear about it. Like, we've definitely had people who've, said things or been somewhat defensive. But once they learn about it, about us and who our patients are, I think you realize we're not taking any patients from you. Like, in fact, we're going to see a bunch of people who haven't been to the dentist in a really long time. They're not actively going to you right now. And by seeing them and doing their preventive care, there's going to be a whole bunch of extra work that we can't do that we're going to refer back into local practices. So we have a lot of practice owners who actually work with us on like a day off, and they can refer people back into their practice. A lot of folks who are just associates at locations, and they refer them back to kind of their main job, if you will. And so, the local dental community actually definitely benefits from Jet Dental because we refer so many patients back into kind of the whole ecosystem, if you will.
Yeah, I think that's fascinating because you're using not only the talent that they have, but you're also sending back people that normally wouldn't even show up. They wouldn't even make an appointment. Yeah. So it's a win-win, I think, across the board. And then let's talk about the relationship with the insurance companies because obviously you're billing them. They're the ones paying your team to do the services that you're providing.
Right.
How has that kind of changed over time? Was it always initially like they were happy about it, or did they feel like, hey, these are things we were just taking this premium money and keeping it?
Yeah, I mean,
versus
I think
now we're spending it.
Yeah, great question. So I think initially there was a little bit of like, oh, are you going to dramatically increase utilization to the point where it's not beneficial?
Yeah.
And I think actually brokers probably worried more about that than the carriers did. But really quickly the carriers are able to say like, no, preventive utilization is always a good thing, right? If you have people going regularly for preventive care, it prevents a whole bunch of other stuff, right? And that's kind of obvious. If I can fill a cavity for a couple $100 instead of do a $2,000 implant,
big root
right?
canal,
Like that's 10K savings right there, right?
Yeah.
Not 10 grand, you know what I mean?
Yeah.
10 times savings, 10x savings.
It's a
what
big
I meant to say.
savings,
Yeah,
yeah.
10x savings. So preventive utilization is really important, and so carriers are all bought into that, right? That's why they cover preventive care typically 100%. In dentistry, that's typically the case. You can get a couple visits a year. And so where it's evolved and changed, I would say, is about 40% of our referrals, our business comes from referrals from carriers now. So different insurance carriers across the country are referring group clients to us and saying, hey, for example, they're looking on their end and saying, hey, you've got about 50% of your people are not going to the dentist even once a year. And we've got a tool, we've got a solution. Jet Dental can come in here and we can help improve that, right? And so we can do a campaign with those folks and we can get them to see the hygienist or the dentist. So
that's awesome. Yeah. I think that's so cool that they're the ones referring you in because they can see the data. It makes sense.
Yeah.
Have you seen certain industries be more likely to adopt Jet Dental, or has it been kind of...
Yeah, so pre-COVID, like the only thing we served, it felt like, was white-collar tech companies. It was just all day long. That's, they're already doing massage and they've got beautiful gyms on site and all those things. And so we were like a really easy fit into that. Now it's about 50% kind of more white-collar tech, finance, industry, 50% more blue-collar, like manufacturing, food service. I'll say essential workers, like healthcare workers. They're not really blue-collar, but they got to be on site and they have less control of their, like they have a specific shift and things they have to do. So it's about half and half when we look at our data. So we've served everything from chicken plants all the way up to like the NFL and really nice, beautiful workplaces. T-Mobile, AT&T are clients. So it really just depends. It really doesn't matter, I guess is what I'm saying. As long as you have a lot of people in one place, that's a great fit for us. So we also serve prisons and jails across the country. So really anywhere where there's a group of people, we can bring our services to them.
I think that's an interesting channel that you've opened up. It's just with the government. I'm sure that took quite a while to figure out, but now that it's in place, I mean, it can only continue to expand and grow in other areas.
Yeah.
What's the process like for an employer to onboard Jet Dental? Is it they just basically give you some dates? I mean, how does that all work?
Yeah. It's pretty simple. I mean, you can schedule a call on jetdental.com or go request information. But yeah, schedule a call with one of our team members. And yeah, it's as simple as you reserve a date, you clear the room, and then we come on site and set up our equipment. So we create all the marketing material for them to forward out to their employees to sign up online, so appointments can be set ahead of time. So we make it really easy for the client. So really the only thing we require of them is a certain minimum number of appointments. And as long as they hit that minimum number of appointments, it's free to the employer.
Wow. And as you've been growing and expanding, talk about maybe some of those constraints and what it's like. Because I'm sure like finding different pockets of employers, it's definitely hard. And, down in certain cities are growing, some are shrinking. Like, how do you manage that and what's kind of the balance there?
Yeah. It's hard. It's certainly hard. There's always a little bit of a chicken and the egg. So typically when we start a new area, like I'll give you an example, Texas, we just opened a team in Dallas when we first started in Texas. Now we have 3 teams and we're adding a 4th this year. So we've got Dallas, Austin, Houston. Well, originally Dallas was serving all of Texas. And so logistically that can be difficult, right? Like you got to plan for travel and you got to start hiring local providers in that local area, and then our office managers driving down and bringing all the equipment to them. So generally we start with a bigger geographical circle, and then we shrink that circle as we grow and have more demand in the area. So we kind of look at a few things. One, we look at geographic need, right? Like there's certain obvious holes, if you will, on our map of the country. So we're nationwide. We've got 20 teams. So some of those teams are covering a couple of states. Mm-hmm. And so we have states I would call that are fringe states. So Mississippi is an example. We do events in Mississippi. We've done events in Mississippi. We're not actively marketing in Mississippi. Like we're just doing, maybe if a company that we already serve has a location there.
Right.
And so we're already credentialed, and we have dentists who are saying, yeah, when you're here, we're ready to work with you. And so we have that spread out. But that gives you an example of some of the challenges, right? Like we had to go and find people who were willing to work with us before we were ever there to be able to be nationwide.
Build those relationships.
Yeah.
What is a team? What's that? What do you?
It's typically starts with the office manager. So the office. Well, I'd say it starts with the dentist. Actually, like we have to have at least one dentist in a state who says, "Yeah, I want to do this," and is willing to get credentialed with the insurance carriers. From there, you get the office manager, who they kind of run the show, right? They are responsible for the inventory of the equipment, showing up on site, helping hire all the other hygienists and assistants. And so a core team is going to be an assistant, a hygienist, an office manager, and a dentist. And then you start adding temporary or part-time people from there, more temporary and part-time hygienists and more temporary and part-time assistants. So yeah, when we grow, it's definitely challenging. Like I think you look at, is there a geographic hole, and we just need a hole there, but also is there a lot of demand there, right? Like we have 2 vans in Virginia, and I wouldn't have pegged that as like my number, like a place I'd have 2 right out the gate, but it was just gangbusters from the start. Like people were eating it up, and that van got so busy, we had to add another van almost right away to meet all the demand. Texas grew really quickly. California has grown kind of slow. It's arguably the best.
It's a tough spot there.
But there's a lot of work from home and a lot of remote still from COVID, and so we still only have one team there, and so a lot of it is there's science to it, right? Like we have a lot of data, but there's a little bit of feel too, and just like what we're hearing in the marketplace and what we're seeing from our pipeline of sales, and so yeah, it's hard for sure.
Interesting. So how do you lead teams? I mean, that's because you're here in Utah. You've got teams remote all over the place. They're professionals. A lot of them are it's a dentist that's gone through a lot of schooling. How do you manage the culture and leadership with that kind of dynamic?
It's a huge cliche, but it is really, really true that having great people is key. For example, the office manager I already highlighted is a key role in Jet Dental. Like that, they're where the rubber meets the road. Literally, in our case, they're vans that carry all our equipment, and so they're a really important piece of the puzzle. And at one point, a few years ago, our service level started to decrease a little bit. We track Net Promoter Score. Our Net Promoter Scores are fantastic. They're in the 70s from both patients and clients. But we started to see a decline a couple years ago. And so we made a really conscious choice to pay more for that role, and we upgraded in some areas where we needed to upgrade. And our service levels have been off the charts since. Again, world-class, in the 70s Net Promoter Scores. The average dental office there, they have a Net Promoter Score of 1, which is probably not any practice.
They probably just don't track
People
that
don't
very
love
well.
visiting the dentist, and so if you do, that's probably hard. So we have some unique things going in our favor where we're bringing it to them, which probably gives us some positive scores. But again, hiring those right people and paying more for them and getting a better crop and quality of candidate has made a huge difference. And so if you have great leaders throughout your organization, I love my executive team. We've got a great CFO, a great VP of Ops, great VP of Sales, and their middle managers underneath. We call that our LAC, our Leadership Action Committee. Like all that group, we meet once a month and we talk about challenges in the business. That group is fantastic in Jet Dental, and they're really what make everything work. And when I first started the company, that was one of the hardest. This is my first time being CEO and a co-founder, and I'd always been like a VP of sales or a director of sales, and so like I had one very specific department, and I knew exactly what the goals were in that department.
Right. Paying the money.
And figuring out how to spend my time was really hard, and it became a lot more fun, and we started growing a lot faster and doing a lot better when I had great leaders running those different departments. And so high level, I think that's the most important thing, is you've got to have people you trust. You got to have people who get it and who are smart and hungry, humble, all those things. Again, total cliche, and you probably read it in every business book that's out there, but I've learned it time and time again. Like when we have bad people, bad leaders in bad spots, things really start to fall apart.
I can see how that could happen pretty easily with everyone remote, but you're going to do that good feedback loop. I think it's the good thing is you're tracking, and you're not necessarily just leaving it open-ended. You're finding out and you're improving. I think that's what's been great about your story, is that you've figured out the idea of working, but you continue to make it better, and it's never going to be done necessarily. You just keep improving the process. And the more and more I dig into how employers pay for healthcare, and then this dental piece is super unique because it's just structured different than the health side. But at the end of the day, it's the same concept. If you get the care and you're able to do that, you're actually making your employees more focused on work, and it benefits everyone involved. And it's a great thing that I think service that you're providing. It's super awesome. What's next for General? What's the future hold? Where do you hope to go? Is it going to stay just U.S.? You going international? What's kind of the vision?
Oh yeah, we've looked at some international things. I think right now we have a lot of markets where we want to double down in the U.S. So I think over the next couple of years we'll get it to where we at least have one van in the top 40 major metros. As I mentioned, we kind of have 20 teams right now, so we got to double that. Yeah. And so I think over the next few years, we're focusing on the U.S. You get into like Canada, and there's government funded insurance, and so it gets a little trickier. But yeah, we're going to grow nationwide. I think we'll continue to expand our offerings. So as we get deeper regionally, we can start to add some things and add some product offerings to probably not be a true dental home. Like we probably won't ever do everything for most clients, but we can start to add more to our services so that you can keep it more convenient and have it done there in-house. But yeah, we're still pretty young and relatively small, and so we have a lot of growth to do.
Love it. Last question, and this is more not necessarily on Jet Dental, but if you were to go back to right when you came out, where did you go to college?
BYU.
Okay. Awesome. And what did you graduate in?
Entrepreneurship track for business management.
Okay. So if we were to go back in time, that fresh college graduate, what would you tell yourself that you'd wish you'd known now that you've been through this process? You're CEO of a growing company that's doing great things. What would you have told yourself?
That's a good question. I can think of some very specific, like, focus on a business that has high margin, because that makes everything a lot easier. But I don't want to give you that answer. I think one thing I would tell myself is try to enjoy the process a little more. Like I think, especially as a founder, it's really, really easy. I think we all do it, right? Like, as soon as you
always kind of
like I remember as a
for the
15-year-old, like, when I get my driver's license, man, like that'll be everything. But I think as an entrepreneur, it's really easy to say, when we get to this level, like, man, then we'll feel like we made it. When we get to this level, man, then we'll feel like we made it. And I'm not great at it, but I've learned to enjoy the process part of it a little more, like enjoying small daily wins and small little improvements. And there's a great book called The Gap and the Gain that talks about this, that just says, like, generally driven people always move the milestone and they never get there because you never get to the horizon, right?
Keeps moving.
And so you just kind of keep moving the goalpost. And often you look at the gap in your life instead of looking back at the gain. Like if I look back at Jet Dental and I think back on some of those early years and mistakes and stumbling and, we've come a long way. Like I have so much confidence in our team and our ability to deliver a great patient and client experience. And, are we where I want to be right now? No, but we've come a long way, and we've got a fun, great little company here. We've got some great people. I've made great relationships. And so I think just having more joy in the journey, again, like tons of cliches on your content here today.
That's very good advice. I see that all the time.
But I do think, like, I didn't appreciate that the first couple of years at Jet Dental, and I often got like the Sunday scaries where I was like so worried about everything I had to do starting Monday morning, and I don't feel that as much now. Like I truly like enjoy the process of how can we make this part better, and I think as soon as you can adopt that mindset and like really know that, hey, you're going to make mistakes, but they're probably never going to be catastrophic. Like rarely is that the case, right? And you learn from it and you grow and you're better from it, and just get out and do. Get out and if it's a product, get out and sell it and figure out how to sell it better by making some mistakes. I think people over-engineer things in their head and over-worry about stuff.
They wonder what if instead of just going.
Yeah.
No, that's great advice. I love it. That's a great story. I'm excited to see where you go. I think it's a huge benefit to a lot of people. And to me, that's what drives me to do what I do, is like there's a need out there for people to understand they can get good care, and then in the day it's potentially more time with your family, more money to do things with your family. Like it all benefits you to enjoy your life better, and that's the point of I think your business is just impacting families, which is great.
Yeah.
That's a great thing to be in.
Yeah, thank you.
Well, thanks for the time, Jordan. It's been awesome.
Yeah, thanks, Jay.